Boxer's fracture or fifth metacarpal neck fracture. Your hand's metacarpal bones connect the bones in the finger to the bones in the wrist. There are 5 metacarpal bones. 1 to connect each finger to the wrist. The head of the metacarpal bone connects it to the phalanges of the finger. The shaft is the long, slender part of the bone. The neck is the part that connects the shaft to the head. The base is the part that attaches to the bones of the wrist. A boxer's fracture is a break in the neck of the 5th metacarpal bone in the hand. It gets its name because the injury is common in inexperienced boxers. There are flexor tendons on the palm side of the metacarpals that act to flex or bend the fingers. There are extensor tendons on the back of the hand that act to extend or straighten the fingers. In between the metacarpal bones are the small intrinsic muscles that further help to control fine finger motion. When a metacarpal fracture happens, the finger flexors and the intrinsic muscles act together to bend the metacarpal head toward the palm. Therefore, the dorsal angulation of the fracture happens. Causes. A boxer's fracture most commonly occurs when someone punches a hard surface or another person with a closed fist. A boxer's fracture can also occur when you try to break a fall with a closed fist to the ground, or by direct trauma to the hand. Symptoms. The typical symptoms of a boxer's fracture are pain or tenderness on the hand near the broken metacarpal bone. You may also have pain when you move your hand or finger. When a bone is broken, you may have snapping or popping sensations. Your hand may swell, discolor, or bruise around the fracture site. You may also have some deformity of the broken bone. You may notice movement of the broken bone fragments. When making a fist, the finger that is hurt may appear misaligned. It may bend toward the thumb more than is usual. This is known as rotational displacement. Diagnosis. Your doctor will ask you about your symptoms, how you injured the hand, and your past medical problems. He will also examine your hand carefully. One important aspect of the physical exam is whether there is a rotational deformity of the fracture. This can be assessed by asking the patient to make a fist. In normal pattern, the fingers should all line up properly and be parallel. If the finger corresponding to the fractured metacarpal does not line up properly with the surrounding fingers, then the fracture ends are most likely rotated. When this happens, often the injured finger will scissor under or above an adjacent finger. An X-ray of the hand can clearly confirm a boxer's fracture. Typically, the X-rays look at the hand from 3 different directions: anteroposterior, lateral, and oblique. Getting images from different angles makes it easier for the doctor to see possible fractures. Treatment. In the great majority of cases, there is not too much deformity of the bone ends. More deformity can be accepted in the small finger without needing surgery, because these fingers have a great compensatory capability in range of motion. Normally around 45 degrees is often tolerated in the small finger. A gutter splint or cast should be used to immobilize a 4th and 5th metacarpals, leaving the thumb, index, and middle fingers free. The fingertips will be usually out of the splint and left free to allow them some motion and to not get stiff. The splint is applied in position of hand function. Mild wrist extension, 70 to 90 degrees of flexion at metacarpophalangeal joint, and slight flexion at the proximal and distal interphalangeal joints. For pain, you can take non-steroidal anti-inflammatory drugs, Talk with your doctor before using these medicines if you have heart disease, high blood pressure, kidney disease, asthma, or have had stomach ulcers. Once a broken bone is immobilized and you stop moving it, you should have less pain. X-rays are checked every few weeks to be sure the fracture is healing properly and the bone ends maintain their alignment. In most cases, the metacarpal fracture heals well and does so over the course of 6 to 8 weeks. Smoking slows fracture healing times. In some people, it can stop healing altogether. Stopping smoking during the healing phase of your fracture will help ensure the best recovery. Operative stabilization is necessary for metacarpal fractures where there is too much bending more than 45 degrees or displacement at the fracture site. Also, if the broken bone protrudes from the skin, or if there are multiple fractures, or if rotational displacement is present. Any rotational deformity is unacceptable as this deformity is poorly tolerated even after the fracture heals. Surgery is also used for people who use their hands for minute motor skills, such as playing the piano. Sometimes an attempt at realigning the fracture is possible without an incision. If successful, the patient can be treated in a cast as previously mentioned. Following a metacarpal fracture treated operatively or non-operatively, physical therapy is needed to regain full use of your hand. Home exercises to regain strength and range of motion. The exact timing of an athlete's return to their sport and laborer's return to their work depends on the kind of sport and job, how severe the fracture is and how stable the fracture is. Follow your doctor's instructions about that. An untreated boxer's fracture can lead to a decrease in your ability to grip, limited range of motion of the finger, and an abnormal-looking finger. With treatment, these problems are usually minor, if they happen at all.